And joining me now, Health Canada's Chief Medical Advisor, Dr. Supriya Sharma, and we're also joined by Dr. Howard Njoo, Canada's Deputy Chief Public Health Officer. First of all, doctors, welcome. Happy New Year. Hope you're well and surviving this next wave. This big day today, Dr. Sharma, why don't you tell us why this course of pills, not only why this is an important day, but how it actually works?
So we've authorized Paxlovid, which is a combination of two medications. It's an antiviral that really prevents the coronavirus from replicating or reproducing itself in the cells. And the reason that it's significant is because it's the first preventative treatment that we have that you can take in pill form. So it's taken by mouth. We have others that are injectable, and of course that means you have to go into hospital at least for a number of hours to get those infusions. So this is something that can be taken at home or outside of the hospital. And it's been shown in the clinical trials to show really significantly decreasing the risk of somebody ending up in hospital or in the intensive care unit or really having serious illness from COVID-19.
And Dr. Sharma, let me just quickly stay with you. So just give us the protocol about the course of doses. It's not one, it's two drugs. You got to take it over 5 days. How many pills a day? Just describe what someone would do if they were prescribed this.
Right, so there's two different pills. One is the pill that actually prevents the virus from replicating, and then there's another medication that makes sure that you have good levels of that first medication, so it prevents it from breaking down. So you take two medications, two pills of one kind, and then one pill of another one. So you take 3 pills at a time, and you take that twice a day, so 12 hours in between those medications, and a course runs for 5 days.
So 30 pills over a course of 5 days. Dr. Njoo, so how would this work? Who gets this? Who would you be giving this pill to?
Well, thank you very much for the question, Evan. And that obviously is what we're very seized with at the moment, because as our ministers announced earlier today, we are getting a limited supply. So it's good news that we are getting Paxlovid into the country. But as you said, who could benefit the most? So we actually, I think hopefully it's on the website or coming out soon, we actually, with an ad hoc group of clinical experts, got their perspective in terms of, how would you use it in sort of on the ground, in the real world. And so we have those considerations, and we have prioritized sort of 3 main groups that we think could most benefit from the use of this drug early, recognizing there are some what we call logistical challenges, the fact that you have to be diagnosed and take it within 5 days of onset of symptoms. And we know some of the issues with getting testing or access to testing in various parts of the country. But if you do get that positive test result, and if you're one of those sort of 3 groups, or obviously anyone who is moderately, severely immunocompromised. Secondly, anyone who's over the age of 80, who's I would say not sort of up to date with their vaccinations, and of course then anyone who's over 60 who's not up to date with their vaccinations, but has other factors such as living in a remote or isolated community, an Indigenous community, a long-term care facility, or other setting where I would say that social determinants would obviously also play into how well they might do if they were to unfortunately develop a more severe consequences.
Okay, but just to be clear, if someone has already got a 2-shot dose, could they get this, Dr. Njoo, or a 3-shot? They've already been boosted. They're immunocompromised, but they've been boosted. Would they be eligible for this?
Well, I think it really depends in terms of how the provinces and territories determine what the vaccination status plays in terms of the criteria. I would say that obviously someone who's not vaccinated at all, someone who hasn't even received their first dose, probably if they fall into one of those 3 groups, let's say, for example, someone over 80, they would probably most likely benefit from this medication. But certainly if someone, let's say, had only 1 or 2 doses, they could probably benefit as well, but maybe not to the same degree as someone who's not even vaccinated at all. So I think that also underlines the point that, hey, vaccination is still the best means of preventing illness at all, and especially severe illness and severe outcomes.
Dr. Sharma, let me go back to you. We've discussed this a lot, vaccine hesitancy. People had been concerned about the side effects of the booster vaccines. Now you've got this new Pfizer product, the at-home, you take these 30 pills. What do the studies say about any possible side effects?
Well, it is a medication, and we know that every medication that works also has potential side effects. The main side effects for these medications are really around drug interactions. So because of the way it works, it interferes with the way that some drugs are metabolized. So there's a fairly long list of medications that you can't take with Paxlovid, and there's ones where you potentially have to be watching out for changes in your medication. But overall, it was interesting in the clinical trials. If you looked at overall adverse events, people that were getting the placebo or the sugar pill actually reported having more side effects than the people getting the pills overall. And even in terms of people that needed to stop taking the medication during the clinical trial, there were more people that felt that they had side effects, and so they would stop the medication for ones that were not actually getting the medication. So out of the other sort of common side effects that we've seen is that sometimes it changes your taste a little bit, so you can lose your taste or sense of taste a bit. There's some diarrhea or vomiting in some patients, but overall it's really well tolerated, except for these drug interactions that we need to really watch out for.
What is the efficacy rate on this? Pfizer says it's really high, Dr. Njoo, or maybe Dr. Sharma, whichever one of you is better on this. What is the studies? I know they've had, well, they said this is really effective, and there's clinical research. Are there widespread kind of journals who have studied the efficacy of this, Dr. Sharma or Dr. Njoo?
Sure, I can start. I mean, the studies that were given to Health Canada for the authorization have not yet been published. So we have that data from those trials. It was looking at people that were not vaccinated, so at higher risk of having severe illness. And they were given the medication within 3 days of having those symptoms or within 5 days. So quite early in that course of illness. And it was very effective. So it was showed an 89% effectiveness in keeping people out of hospital if you catch it before 30 days, and 85% if you catch it before 5 days. So again, though, that's in people who were not vaccinated, and we know that people that are unvaccinated have, it's up to a 20 times higher likelihood of ending up in hospital. And it was so effective in those clinical trials that they actually stopped the trial early because it met its endpoints, and it became unethical to start giving people placebo or those sugar pills instead of the medication.
Interesting. Dr. Njoo, go ahead, because go ahead, because the real key is when people when is it effective to take? I know you've got to take it within 5 days of the onset of symptoms, or a test, an antigen test, a PCR test. It seems that when you start taking these is really critical to its efficacy.
Definitely, certainly from the clinical trials, and just to add to what Dr. Sharma said, certainly there's a difference between what, from a technical perspective we call efficacy, or how well something works under ideal control conditions of a clinical trial, and what we call the real world effectiveness, how well it works, as you say, in the real world under the usual conditions that we would see being used in the provinces and territories. So to your point, we recognize that the province and territories, ideally, if a patient were to develop symptoms, they should be taking this medication within 5 days of onset of symptoms. But also, that's obviously preceded by having a sort of a lab test to confirm they actually have COVID-19. And certainly, the clinical experts we spoke to, they recognize that obviously with a valuable medication like this, which is obviously a somewhat limited supply at the beginning, that we really need to make sure that we give it to patients who really have COVID-19. So, having that test result that's positive, I think is critical to starting this treatment as well.
Dr. Sharma, just the last couple things. The pill is just apparently to treat mild to moderate COVID cases. How do you determine that? Why not more severe cases?
Well, by the time somebody has severe symptoms, you already have virus there. It's already causing that inflammatory response. And the way that this works is that it catches it. So the virus comes into the cells, and before it really starts reproducing itself, that's when this medication works best. If you already have the virus and you already have more severe symptoms, you're probably beyond the time where it's actually going to work very well in trying to prevent that serious illness.